Hi, everyone. This is Suzanne Barnhurst, and I'm here today, to start the week 1 lecture in healthcare management and marketing. I hope you've had an opportunity to watch my welcome video, as well as look at the course information, the Start Here tab, the syllabus, maybe go through the first 2 units a little bit and acquire your text. What I'm going to do today is just review a couple quick things about how the course is going to work and then go into the week 1 lecture. First of all, what I'd like you to be able to, what I'd like you to know and remember is that this is an asynchronous course. It starts every week on a Sunday. All the assignments are due at the end of the day on Sunday, the following Sunday. That includes discussion forums. Sorry, that's Dan. Thank you, Dan. As soon as he hears me recording, he has to join in the fun. Assignments are the same way. Once it's assigned, when the due date occurs, you are to upload it to the Blackboard on the date that it is stated, and it's at the end of the day, which is 11:59. Discussion forums, the first post is due on Thursday. The last post again is due on Thursday at Sunday at 11:59. You have 3 assignments this semester in addition to the 8 discussion forums. 1 is a reflection paper, 1 is an individual case study, and 1 is a group project, which happens to be a case study on the Community Health Needs Assessment from Lehigh Valley Health Network. I will post that assignment next week and discuss with you the group project itself. You'll receive a weekly announcement from me. It comes up in the announcements window in the left navigation bar. You'll also receive it by email. Unfortunately, those Blackboard emails say do not reply. I will put my email at the bottom of the announcement, so if you have a question, you can just reply to it and in regular Outlook, and I'll take a look at it. And speaking of questions, if you have a question about the course, the content, there's a link broken that I set up and somehow it got broken between the time I set it up and now. You're not sure about an assignment date, you're not sure about an assignment. If it has anything to do with the course that other students will benefit from, please post that in the Ask the Instructor form, which is in the traditional written discussion forum link in the left navigation bar. It's the only form there. It says Ask the Instructor. So post those kind of questions there. If you have something, an item of a personal nature that you just want to run by me, send me an email in the DeSales email at suzanne.barnhurst@desales.edu. If it's a personal matter and you want to talk about something or you have a question that you would really like to talk through, then text me first, ask me when's a good time to call, and we'll set something up. Unless it's urgent, then just call. And I will answer the phone pretty much every night up until 10, including weekends. Okay, I think that's it for the course piece. I welcome all 5 of you, and I look forward to working with each and every one of you this week. I have been in healthcare and healthcare management my entire career. It's constantly changing. It has its benefits and it has its downsides, just like everything else. But I went into healthcare because I wanted to make a difference, like many, many people do. And I wanted to take care of people. And I have managed to do that in multiple different ways throughout my career. And I still find patient interaction the most fulfilling. And that's part of the reason why I'm now an instructor, because I like student interaction also. So let's start here with chapter 1, an overview of healthcare management. Before I get started, I want to just sort of give you my introductory thoughts on healthcare. Healthcare management versus business management. Healthcare management is different in some ways, and I want to talk about that a little bit and emphasize pretty much where I'm coming from when it comes to that perspective. Healthcare management emphasizes, healthcare management obviously emphasizes the healthcare field, anything that has to do with the healthcare field. Business management degrees emphasize other general business, and that includes many, many different types of services. It can be industrial, it can be retail, it can be service oriented. And those industries all have their particular requirements, education requirements, experience requirements, technology requirements, et cetera. Healthcare is the same thing. But in healthcare, the purpose of a healthcare manager is definitely going to be to manage others in a healthcare setting. You're going to be managing people because healthcare is a people business. So you're going to be managing people. And these different settings that you're going to be managing them in is varied. Everything from acute hospital setting to long-term care in a nursing home to an outpatient services organization that might just be a place where you can go get lab work and x-rays. It could be a place where you can get surgery. It could be a doctor's office, a primary care or a specialist. It could be an urgent care facility. There's many, many different places that you could become a healthcare manager. You could also become a healthcare manager in an industry that supports healthcare. That would include device management, devices, medical devices like wheelchairs, home care equipment, stents, that kind of thing. And you have opportunities to work with for-profit and not-for-profit. So there's lots of different entities, things that are involved in healthcare management. There are other more differentiating elements that add a dimension in general services. Usually does not have that, and it's the human emphasis that's so different with healthcare. General business, different services doesn't have that human element all the time emphasized as like healthcare does. Healthcare is mostly humans helping humans. We help humans face and recover from healthcare problems. Those of us in healthcare help people with their daily living. If they don't have good healthcare, they don't have a good daily life, or what we call good quality of life. So we, as individuals, we need food, clothing, and shelter. We need those things. We don't just desire them, but we need them. We also need food, clothing, and shelter to survive, but we also need healthcare, not only to survive, but to thrive in our environment. And if we are disabled somehow, if we have a chronic condition, if we just have your basic hypertension, or we have a mental health problem, we need healthcare professionals to help us get along. And if we didn't have them, we would end up, unfortunately, like a lot of people who don't have healthcare, which is not in very good health and not very good conditions in regards to their financial status and their housing status. Seems like they don't have good healthcare. They don't have a lot of things that are beneficial. So we need healthcare. And we are a group of people that are humans helping humans to survive and thrive. If you're a manager in healthcare, or anyone in healthcare for that matter, anyone in healthcare, you're affecting somebody's health, if not their life, every single day. If you work in an emergency department, you literally could be saving somebody's life today or tomorrow. Like just what happened last year. How many lives did we save during the COVID pandemic? And how many nurses and doctors put their life on the line to do the same thing? So we actually are affecting people's lives every day if we work in healthcare. And that includes management, because managers are the types of people that help pull the organization together. And not all people are good managers. Some nurses are excellent nurses, but when they're made manager, they're terrible because they just don't know how to manage people. I worked in nursing. I'm a nurse. I've worked in nursing. I've worked in sales. I've worked in marketing. I worked in home care. I worked in electronic health records for a while. I've never seen a really good sales rep become a really good manager, because they usually have skills from one side or the other. And it's the unusual person who can identify that they don't have those skills and move themselves forward and get the training and everything that they need to become good managers, even if they don't initially have the skills. So the effect of your management skills make an impact every day, even if it's just a smile to a patient or a frightened family waiting for a patient to come out of surgery or from the ER, you can make a difference every single day. And it doesn't take that much if you're a manager. You may think as a manager, if you're not in clinical care, that I don't have anything to do with patients, or I don't have any hands-on, we used to call it, but that's not true. Every contact you have with people who are taking advantage of your healthcare services is one that can make a difference with them. In marketing, we call those touch points. In healthcare, we just call that general caring. If you're in healthcare, you generally care about people and you want to help them. So as a manager, you can make just as much of an impact as a nurse or a doctor that's actually clinically taking care of somebody. So that's my perspective on management and healthcare. So this week we start with chapters 1 and 2. And the first one is an overview of healthcare management, and chapter 2 is on leadership. I am basically, I didn't write a lecture, because if I do, then I end up reading the whole thing. So I made myself a lot of notes throughout the text, and I'm just going to summarize it for you. And I'm going to go over chapter 1 more than chapter 2, because chapter 2 has a lot of things in there that are not particularly applicable to this course, because it's a little too short, but we'll talk about it in the first part of the chapter 2. So while you're listening to me, if you have a question, please jot it down, and be sure to ask it in the Ask the Instructor form in the discussion forum tab in the course. That way everybody gets to see it and we can have a little bit of a discussion about it. Okay, excuse me. You'll see me drink water frequently because I have something going on with my throat. So, okay. So there's two types of settings that you might be a manager in. They're direct care settings and indirect. And I sort of mentioned them in the intro. Direct is hospitals, nursing homes, any place where there are patients on a regular basis and you're taking care of them. Ambulatory clinics, outpatient services, acute care hospitals. And then there's non-direct care setting, which are the support services, durable medical equipment, device equipment, pharmaceutical companies, health insurance companies. Medical billing is a big thing. There's a lot of organizations that outsource their billing. And then there's some new things that we have now that you might not think yet as being of healthcare, but they include things like your Fitbit app, your health app on the iPhone, your coaching, your health counselor coaching through your insurance company. They're also an alternative non-direct care setting that we have as patients, as consumers of healthcare, to use to help improve our healthcare. So as a manager, you'll have an opportunity to work in any of these areas, and all of them have to do with taking care of patients. So what's been happening with healthcare in the last, let's see, this is 2021. Since 2016, where do we see healthcare going? Well, the text shows a couple of really good graphs and charts in regards to this trend. It says that employment in healthcare and social assistance, which is social work, behavioral health management, those sort of things, is projected to add nearly 4 million jobs by 2026. And at that time, that would be 1/3 of all new jobs. 1/3 of all new jobs in 5 years, or less than 5 years, will be healthcare in the healthcare industry. It doesn't talk much about why that is, but there is definitely a aging population. I do say that is the main growth factor. There are baby boomers turning 65 every single day, 10,000 of them, I think, till 2026. It started way back in 2016 or earlier than that. 10,000 people every day turning 65. All of us in that age bracket have issues as we get older. Many of us need joint replacement or more than one joint replacement. Many of us need physical therapy, occupational therapy. There's numerous things. Balanced care. Some people, as they get older, we have terrible balance issues. Balanced care. There's all kinds of healthcare needs for people who are over 65, 55 and over, but over 65 right now. And then we will need people to take care of us. We will need people to do surgery on us. We will need healthcare workers to be there when we need them, when we have emergencies, when we have ongoing issues. The trend to try to stay at home for as long as you can is very strong. People want to take care of themselves at home, so we'll need home care workers. There's all kinds of things that are going to happen, not to mention the technology that's going to change and how that technology is going to affect all of us. So it's the fastest growing occupations. If you look at page 3, figure 1.1, it shows projected percentage change in industry employment, and it shows healthcare or service providing. Healthcare and social assistance is the first blue line on the left. That shows every year it's going to change by 2%. An annual rate of change for wage and salary employment, that means how many people will be getting a wage from healthcare, is 2%. It doesn't sound like much, but it's every year. And if you look down a little further and you look at something like retail trade, it's 0.3% that wage and salary will change there. So if you're looking for employment or a job, healthcare is the place to be, followed by mining. And I'm not sure, I didn't have a chance to look that up, and then followed by educational services private. So there's a few of us that will probably be employed for quite a long time, and all of you will be if you stay in healthcare. Okay, so number one, healthcare managers are expected to be needed in both inpatient and outpatient care facilities. As the line between healthcare delivery systems and healthcare industry starts to blur, the scope for healthcare managers is going to get bigger and bigger. Healthcare industry systems and healthcare systems, let me say that, used to be you had a local hospital and they operated on their own. Now, if you notice, hospitals are no longer called, it's no longer called Lehigh Valley Hospital, it's called Lehigh Valley Health Network. A facility near me is called Doylestown Health. They just dropped hospital altogether and they call it Doylestown Health. So the hospital has now partnered with a lot of providers, being primary care and other providers, specialists, that sort of thing, even visiting nurse services, hospice services. They've partnered with them so that they can create a system whereby they can capitalize on economies of scale for costs, contracts, et cetera, that sort of thing, and hopefully a more coordinated and higher quality of care for the patients in their community. A lot of new roles are going to grow out of these continuous changes, and they are nonstop changes, and are going to continue at least and for some foreseeable future past 2026 also. So healthcare management is a profession that provides leadership and direction to an organization that delivers personal and consumer health services to all sorts of different types of settings. Healthcare is characterized by formal education, specialized training, common values, and specialized knowledge and skills, professional development, credentialing. You have to be credentialed to get a license, and you have to have continuing education. So it's characterized by that, in that a lot of other professions don't have that. CPAs do, lawyers do, doctors do. Anybody has to have a license. Even hairdressers need to have a license. But not everybody requires a license in continuing education, or do they have the same common values as healthcare. Okay, so why do we need managers and their perspective? What is it about them that makes them such an important part of healthcare? Organizations are created to achieve goals beyond the capacity of any single individual. Healthcare is so complex because there's so many people involved, there's so many units or teams that have to pull together. So an individual cannot do it on their own. It has to be done in, how do we say, what do I say? It has to be done by many specialty disciplines. And that's exactly what a manager's job is to coordinate many specialty disciplines, including human resources, so that they achieve the objectives and goals set out by the organization. And managers ensure that the organizational tasks are carried out to the best way possible, and they want to achieve the best, most efficient and effective care Many times that relates to financial and human resources. It also definitely relates to the quality of patient care. In the United States, healthcare is provided across the continuum of care from birth to death, from cradle to grave, as we used to say. And it often goes beyond that. When patients lose a family member, there's care after that. There's, grief services, behavioral health services, those kinds of things that help people. And the same way from the beginning, there's fertility services to help folks that haven't started a new life yet, all sorts of other things that start out your life in healthcare. Okay. So managers have two, what the text calls domains under which they work. The first one is external and the second one is internal. In business management class, we call it environment instead of domain. So the external environment, or the world around you, and all the things that, all the entities and people that have some effect on your ability to do business in healthcare. That's your suppliers for equipment, everyday supplies, your food sources, your physicians, your board, your stakeholders, all your stakeholders. That includes employees, patients, board members, etc. That's your external. The people are internal. The community needs is what I meant. The community needs, the population characteristics around you, what reimbursement your area gets, because every area, regional and even national, your reimbursement is definitely geographically affected. So those are the external things that affect us, not to leave out government regulations. And then the internal domain or environment includes those things like your staff, your financial performance, the quality of care that you provide, the people that affect that, your employees, all those things, stakeholders. So there's two things, external domain and internal domain. External domain has a lot of effect on healthcare these days, between federal government regulations, new rules, and then innovation and all the things that are happening in the communities and the health of the community near you, all those kinds of things. Okay. Before I move on to the next topic, if you go to page 6 and look at table 1-1, it talks about the complexity of healthcare. And this is an important table to look at because it lays out for you 6 different categories of healthcare delivery. The first one is the kind of education you might need. It includes everything from medical schools and dental schools all the way down to professional and trade associations. That's both the direct and non-direct aspects of healthcare. Talks about supplies, pharmaceutical companies, multi-purpose suppliers, biotech. All those folks supply hospitals with the tools, medication, technology that they need to do the job they want to do. Insurers, obviously we know insurers pay the bills. In most cases, they also negotiate contracts with these health systems and individual physicians, which there aren't a whole lot of those left anymore, but they definitely have a major factor and effect on what happens in your organization. Then we have the list of providers. A little bit more complexity here. We have a list of different providers. Every thing from preventative care to end of life care and integrated care, which means integrating a health network, bringing organizations together. And then the next one is payers, which is pretty much the same as insurance. They usually are the payers in most cases. And then obviously the government, public insurance financing, which is Medicare, Medicaid, and CHIP. And they're also the ones that create healthcare regulations and funding. And they do a lot of funding for research, FDA, that sort of thing. Okay. On page 7, there's another chart, 1.3, that shows you if you depending on where you want to work, the managerial positions available in those kinds of settings, physician practice, nursing home, hospital, those kinds of things. Many of you probably already know this. Since I don't know you all yet, and I don't know what you've been doing with your life, forgive me for repeating things you already know, but just want to make sure you know where our starter point is. Okay, excuse me. So management is a process comprised of social and technical functions and activities occurring within organizations to accomplish predetermined objectives through human and other resources. Managers implement 6 management functions as they carry out the process of management. In business, we call it planning, leading, organizing, controlling. Here in this text, they call it planning, directing, organizing, controlling, staffing, and decision-making. They add 2 additional and change the name of leading. Planning obviously is the function that's required to set directions and determine the what needs to be accomplished, the goals and objectives. Organizing, Organizing refers to the overall design of the organization, the specific division or unit, and it also determines teamwork, assignments, those kinds of things. Staffing, this function refers to acquiring human resources. Obviously, you need to have a lot of human resources for health. It's a key management task in healthcare. Controlling refers to monitoring the activities, make sure everybody's meeting their goals and objectives, and then evaluating performance. Directing is initiating action in the organization through effective leadership. So directing is leadership, and leaders and managers are different, 2 different things. And then decision making. Managers need to be able to make decisions based on the knowledge that they have, the knowledge that other people's input, and the data. They need to be able to make good, solid decisions. Managers also need conceptual skills, technical skills, and interpersonal skills. Conceptual skills are their ability to critically analyze and solve a problem. Good things can happen in healthcare. Really bad things can happen in healthcare. If you aren't able to critically analyze a problem and step back away from it, give it some consideration and come up with a solution or know where to go to get those solutions, management's going to be tough for you. Some people say there's a lot of putting out fires in healthcare. There's not if there's a lot of planning, but there can be. And anytime there's a critical issue like a patient problem or a family problem or anything like that, you need to be able to make decisions and not be wishy-washy. And in order to do that, you need to know the mission and values, your own values and your organization's values, so you have a basis on which to move on. Managers also need technical skills. They need to develop a new incentive programs for staff or implement modifications to a computer. They need to be able to understand the technology enough that they know when to change, when not to change, and when to use it, when not to use it. And very importantly, they need interpersonal skills, good interpersonal skills. They need to be able to relate to multiple levels of people, able to communicate well. They need to be able to work well with other individuals, because in healthcare, we do a lot of teamwork. All right, as far as management positions and the organizational hierarchy, I'm not going to talk about that because that is, you may have had that in another class, but it's about the hierarchy of management. And most people, you can read that. That's not too complicated in healthcare. It's very similar. Okay, focus of management. The focus of management has 3 areas according to this text: yourself, your team, and your organization. So there's 3 things you have to focus on. Individuals must be able to effectively manage themselves. That means they need to be able to manage their time, their space, their materials. They need to be responsive to the people that work for them and to their superiors. They need to follow through with things. They need to maintain a positive attitude and be highly motivated. They need to believe in what the organization is doing. If they don't, it's going to be very difficult for them to manage well and be happy with the outcome, because they don't agree with it, which can be an issue. And many of us maybe have gone to work for some place, had a good experience, and then the management changed, and then we didn't agree with it anymore, and we had to make a decision to leave or stick it out and try. But depending on your circumstances, everybody has to do something different. So managers have to be able to be aware of themselves and manage themselves well. Peter Drucker said that managers also need to know what your strengths are, how you perform, your values, where you belong, and what you can contribute, and take responsibility for your relationships. You can't be the type that blames it on everybody else. Somebody in your organization, in your unit, does something wrong, it's basically your responsibility, and you need to be able to take responsibility for it. How you're performing your values, you need to understand your values before you go to work for an organization, so that if your values and their values don't mesh, you may see that as a red flag. So managers need to be able to be very aware of themselves. The second focus of management is at the unit and team level. The expertise of the manager at this level, what their job is to do, is manage others in terms of effectively completing the work. Managing teams is tough. It's really tough, but we do it every day in healthcare. The radiology department does not operate independently of an emergency department. If the emergency department needs films or x-rays and they don't have one in their department, they need to send the patient to x-ray. If the radiology department doesn't coordinate with the emergency department, nothing gets done. So there needs to be systems and processes in place in order to make that happen. And that's with all of the departments within an organization like a hospital. You have your pharmacy, you have your doctors, you have your nurses, you have different floors that do different types of care. All of it has to be coordinated. And you need to be able to have it, as a manager, be a team leader so that you encourage your team to work with everybody on a regular basis. No matter what your job title, I highlighted this in the text, no matter what your job title, you will be working in teams. So if you don't like teamwork, you better think about it now. Let's see, okay. The third management focus is at the organizational or the inter-organizational level, and that is that managers must work together as part of the larger organization or multiple organizations. If you're part of a health system, you're working with multiple organizations. If you're just working with one large hospital, then you're working with management from all those areas also. Okay. Let's move on. What's the role of the manager in establishing and maintaining organizational culture? Organizational culture, every organization has a culture. It's usually distinct. It's known as the beliefs, the attitudes, and the behaviors that are shared among organizational members. Organizational culture is defined as the character, personality, and experiences of the organizational life, the life in which you work in. Culture prescribes the way that things are done, are defined, shaped, and reinforced by the management team. All managers play a role in establishing the culture of the healthcare organization and in taking the necessary leadership to sustain and, in some cases, change the culture. Oftentimes, the current culture starts to fade because it's not innovative enough, it's not forward thinking enough, it's lagging in some other area, it doesn't have enough training and support for its employees, whatever that may be. Everybody's gotten tired of the same old stuff, but nobody can dig themselves out of the rut. So we have an organizational culture change. If you've ever been through one of them, sometimes they can be pretty rough, but they can also change things for the better in the long run. So culture is shaped by the values, mission, and vision for an organization. Many of you, maybe some of you already work for an organization that has a mission, vision, value statement. Maybe you don't. I don't know if you, at this point, have you studied mission, vision, and values before. The mission of the organization is the fundamental purpose. That's all the mission is. The values are the principle the organization believes in and shapes the organization's purpose, goals, and day-to-day behavior. The vision of the organization specifies the desired future, what they want to look like in the future. Statements of values, missions, and vision result from the organizational strategic planning process, which we will cover in another chapter in this text, which is a complex process. But as a manager, you will be involved in that. And establishing that strategic plan and establishing the vision for the organization is really important for you as a manager and as for your organization to move on. I'm going to try and share my screen right now and show you. Okay, there we go. And show you a mission, vision, and values for Doylestown Health. You'll see it says Doylestown Health at the top, and here's the mission, vision, and values. I really like the way this is laid out because it's extremely simple. The mission is to continuously improve the quality of life and proactively, my thing is right in the middle of that, so the well-being of the individuals we serve. Advocate for the health and well-being of the individuals we serve. With a vision, you'll see they have the vision next, to enthusiastically pursue healthcare excellence through collaboration and innovation. There's that innovation word, you're going to be hearing that a lot. We strive to inspire a more vibrant and healthier world for our patients and our community. We consistently strive for healthcare excellence and provide a continuum of connected providers, quality and excellence in service and accessibility to the community we serve. If you see down here, it says service values. I worked for this organization several years ago. And when I worked there and we did the culture change, we came up with the SERVE values, SERVE, and they've updated them to service values. And it's a sign of the times. We serve the community, we strive for excellence, we respect the dignity and privacy of all, we provide value through high quality, accessible services, we seek innovation, and we are compassionate. We are committed to the health and wellness of education of our community. So they added the innovation and compassionate to the values. But I wanted to show you this because I think it is a very simple mission, vision, and value statement of which all organizations, usually, especially hospitals, have one. As manager, because your mission is set out before you, you should be able to make decisions based upon what your mission says. Continuously improve the quality of life and proactively advocate for the health and well-being of the individuals. So anything you do needs to help improve the quality of life, and you need to be an advocate for the individuals that you care for. And in so doing, then you need to believe in the values, which are you're there to serve the community. Everything you do should be in the level of excellence. Respect people, those you take care of and those you work with. Be sure that what you products and services you offer or come up with, your ideas will provide value and not just repetition or not just something that's convenient for you, but the value for the consumer. And you seek to be innovative, you need to be compassionate, and you need to be committed to health and wellness education of the community. So not that every one of you will have anything to do with education or any of those sort of things, but that's the idea, for you to live by these values in your management style. Stop sharing. Okay, good. All right, so that's the role of establishing and maintaining organizational culture. That's your management job. I'm going to quickly just mention things about the next section, which is the role of the manager in talent management. We used to call this human resources, but now we look at it as talent management. The reason that we look at it that way is because we need to secure and retain the talent that we need to do the job. And we need to do it in the best way. We can't just fill jobs with bodies anymore, particularly in healthcare. A lot of changes, a lot of technology, a lot of special education needed. We need to rethink think in many ways we have, and we need to rethink the actual job descriptions within an organization to help make care efficient and effective. A good example of that is, and I'm going to go back to hospitals again. Hospitals used to have a dietary department that would bring the food up to the hospital floor. Every patient had a tray. Somebody from the dietary department would take the tray off, take it into the patient, bring it out, come back 3 hours later and pick up all the empty trays. They also had nurses that would come in and give medication. They also have housekeeping that would come in and clean up the floors, on and on and on. So they decided, in order to keep the dietary people doing what they do best in the kitchen, the nurses doing what they do best in taking care of patients and medication, and housekeeping doing what they do best, they came up with an individual who could take care of room care. That would be, and I know it was a different name than that, but that would be people who had a certain area they were assigned to. They did housekeeping in the room. They made sure they brought in the meals, took out the trays, because it all has to do with trash and that sort of thing. And that frees up the nurse to make sure she's able to do what she needs to do for the care and the medication. Enables the housekeepers to clean the rest of the building, not just the individual rooms, and it keeps the dietary people doing what they need to do best. So that's the kinds of things, the way we change talent and use people's skills. You know, somebody that can put a tray on a table can also probably clean a room very well also. So at different times, no less. Now I'm just at different times. Okay. So beyond just recruiting people, we need to develop and retain these people that we bring into the organization. We need to help them better themselves, give them opportunities to make themselves successful instead of putting them in a box and letting them do this job and not finding out where their talents and skills are. So we need to do talent management, identify the right recruits, bring in the right people, and then grow them for our purposes and for theirs. Okay, so what's the role? The next one is the role of the manager in strategic planning and strategy development. And strategic planning is the process of identifying a future state for an organization. The process is typically carried out on an annual basis, and as managers, you will be involved. Strategic planning usually includes top-level management, middle-level managers, board members, other important stakeholders, and oftentimes they'll do something that's like an off-site thing, and they'll do a 5-year plan, and then every year they'll revisit it. So as a manager, it's you are involved in the development, and you're also involved in the implementation. You'll leave a strategic planning process with an idea of where your department fits in the strategic plan and what you have to implement going forward. Excuse me. What is the role of the manager in ensuring high performance? First of all, your goals and objectives have to be set for you. You have to be clear on what they are. Organization needs results to be results oriented. Excuse me. Organizations need to be results oriented. They need to have defined pillars of excellence as a framework for the specific goals of the organization. In this case, they suggest that the pillars be people, employees, patients, physicians, service, quality, finance, and growth. So those would be the pillars of that you want to be results oriented around. And as a manager, the goals and objectives, if they're not clear, your employees, the people that work for you, won't be clear on what they have to do. So to ensure high performance, there's some specific things that managers do. The text talks about 5 key steps in the performance management process. And that is, as a manager, you set the objectives, you measure the performance, you know what the performance is before you set the objectives, and then you measure the performance while it's ongoing. Compare performance with objectives, determine reasons for the deviation, whether it's good or bad, determine reasons for the deviation, and then take corrective action, or not, sell it. If you don't have to take corrective action, then you want to celebrate. Definitely celebrate. Management's job is to ensure that performance is maintained, or if it's below expectations, improved. And if it's above expectations, you should be celebrating, because often we don't do that often enough, especially in healthcare. Stakeholders in the healthcare today, especially those outside the external domain or environment, include the state and federal government, consumer advocacy groups, other insurers. They demand acceptable levels of performance in healthcare organizations. And in order to do that, they've set out standards. There's something called the Joint Commission that comes in and then looks at hospitals every year. And I think it's every 2 or 4 years. There's something called Centers for Medicaid and Medicare and Medicaid Services. That's the government arm that pays for medical assistance and Medicare patients. They have established parameters that they want you to comply with. We used to call it not quality. Yeah, we used to call it quality control. How do we control the quality of patient care? And these organizations set forth standards to do so. Now there's many, many more, and other organizations have their own standards, but quality of patient care is always at the top of the list. And then quality of services and other things falls below that. Okay. How do they monitor their performance? Examples are something they call dashboards and balanced scorecards. Often when you set goals and objectives, they'll create a dashboard that you can pull up on your computer. You have a list of things that you want to be watching, and they'll add the data to the computer. And again, that's just data. Another way to find out how you're doing is walk around your organization and talk to your patients and your customers and your employees, anybody that's your customer. Talk to them and find out what they think. Okay, so what's the next section? What's the role of manager in ensuring a positive patient experience? Oh, very important, very important. Patients suffering from illness and injury in many cases are anxious and vulnerable. Most hospitals and organizations have, in primary care, everybody has recognized that the service quality, the customer service is required and allows the organization to be competitive in the way services are provided. Today, healthcare has changed a great deal. You may be someone who's experienced a difficult time getting an appointment with your primary care doctor. You may be someone who had an experience where you needed to see a specialist and you couldn't get an appointment, or you may have had a fabulous experience at a local emergency room lately because your kid cut their head at a Halloween party and you had to take them in, and it was just a fabulous experience. We used to say, I think we didn't used to say, I think people used to think that you got what you got when you went to an organization. Now you'll see that the battle of the hospitals, particularly the one up on 22 with St. Luke's and Lehigh Valley Health Network on the billboards, will tell you all about the services that they offer, the quality of care that they have, and the way they treat their patients. And you also notice that they have identified all sorts of ways to provide those services in a different setting in order to increase the customer satisfaction. Quality of care traditionally quality of care has been the defined way that we look at quality of clinical care, not all care, just clinical care. And now recently it's been realized that that's not enough. That is number one, but it's not enough. So the Institute for Healthcare Improvement came up with something they call the triple aim, which advocates the healthcare systems improve and address 3 dimensions. One is reducing the per capita cost of care, which means care per person across the United States, improving the health of the general population, the population within which the community within which your organization resides, and improving the patient experience of care. So those are the 3 things that we aim for now. How do we make those best in class, in service? Hospitals have mounted increased efforts to provide excellent service experience and are paying closer attention to the overall patient perceptions and satisfactions. If you've been to a facility lately, even a doctor's office, you may have experienced a survey that says, please tell us about how it went. Tell us what your experience was. The patient experience is defined as the sum of all interactions shaped by an organization's culture that influence perceptions across the patient's perceptions across the continuum of care. We call in marketing, we call that touch points. Every place they go, what do they encounter? Do they encounter a really cranky receptionist at a doctor's office who won't pick her eyes up from the computer and speak to you when you stop at the window because she's too busy? Or do they encounter a smiling person who says, how can I help you? And tells you what to do and then says, you'll have a seat, we'll be right with you, or whatever they tell you at that time. And do you sit there for 5 minutes or 50 minutes? So what are all the touch points that we need to be concerned about? Managers first need to understand the processes of providing care and support services. In order to get this under control and know what's happening, they need to understand the processes. So the best way to do that is go through the process yourself. Check yourself into your organization to get your lab work, or go to your doctor's office and see what the process is to get in and see your physician, the wait time, and identify all the different touch points along the way and how well they went. And then you'll know how things go in general. And the other way to do that is ask patients. The text suggests we make things like patient journey maps that depict the steps in receiving care from the perspective of the patient family. That's a good idea, as long as you've done it and you know that it's right, instead of just saying, oh, well, this is what they should be doing. No, you need to know what is actually happening, especially after last year in the COVID pandemic and all the chaos that went with getting testing and not allowing people in hospitals and those kinds of things. There's a lot of changes that have had to be made for that. So now might be a really good time for everybody to relook at that. Second thing managers need to understand is the needs and expectations of the patients. You can't assume you know what patients need. It's the same thing with regular business. You can't assume what consumers need or want, because sometimes they don't even know. You need to talk to them and find out. We do know that patients want to be informed, respected, and supported. We all want that, even if it's not healthcare. And we also want to be treated in a courteous and friendly way. So we know those things. And as a manager, you need to support that and keep your focus on that. On the technical care side, patients want appropriate and timely care provided in the right way in the right time. Just like we want our Taco Bell taco or our McDonald's burger, we want it appropriate and timely in the right way in the right time. And healthcare, we are a little more particular about that. Unfortunately, we don't always have a good understanding of what right time, right care is. We don't always understand that, so that's sometimes where issues come in. Finally, managers need to focus on and improve the physical environment of care, what the surroundings look like, because it promotes comfort, and access is one important thing, and convenience for patients. That's why you are starting to see, or you have seen, many doc in the box type buildings going up here and there. Patient first and urgent care, primary care doctors mixed with physical therapy, lab services all in one building, those kinds of things. It's helping to make the care more convenient. Okay. All right. So if managers assess these experiences and pay attention to it and move forward with the issues and enhance the good things, they'll be more successful. But that's the manager's job in ensuring a positive experience, to know what the patient wants and try to identify that. I'm going to skip the part about the role of the manager in development and succession planning for now. You can read that yourself. But the last thing I want to review briefly is the role of the manager in innovation and change management. This is very important because today, innovation and change management are the wave of the future. If you're not innovative, you're going to be left behind in regards to being competitive. And innovation and change management are related, but they have different competencies. So management innovation addresses the organization's management processes and practices and routines that determine how the work of management gets conducted. So we're looking at things like internal communication, employment assessment, project management, training and development. If we are not calling our human resources department human resources anymore, and we're calling them talent management, then employment assessment is important, because we want to bring in the right people. And we don't want to do that with the old tests and the old interview style, where we send them to 6 different people and everybody tells you what they think about them. We want to do it with some quality data collecting type tools to help us understand those things. Operational innovation addresses the organization's business processes. These include the customer service, procurement of supplies, the supply chain, care coordination across staff, and development and use of clinical procedures and practices. So there's a lot of opportunity there for change and innovation on a regular basis, depending on technology and depending on consumer needs and demands. There are specific skills needed for managers to be innovators. Not everybody's an innovator, because not everybody's a risk taker. And to be an innovator, you need to be a risk taker. You need to at least think about what it would look like if it was different, and how would I make that happen? And is it needed, or is it crazy? And you also need to know how to talk to other people about it. So these skills include being able to think creatively about what ways to change operational things. You need to be able to think about management practices to improve the organization. It needs a willingness to test these innovative practices, because you want to test to make sure they might work. It also you need to be able to take a risk and see if, going forward, if it's really going to be beneficial. You also need to facilitate recruitment and development of employees who are creative and innovative. In my stage of life, I see the younger people are often more creative than many of my coworkers, because I do think a lot of it has to do with the gaming trend. People are more creative because they spend more time thinking about those kinds of tools. And I also see them more creative because they don't seem near as stressed as most older people. they just have a different way to look at it. So you need to look for people who are embrace creativity and innovation and aren't afraid to try anything new. Okay. A culture of innovation depends on staff who are generating ideas for operational innovation, and the manager is the linchpin in establishing a culture of innovation that supports idea generation. If a manager doesn't support your idea generation and kind of says no thank you, or when you do it and it doesn't work, you face negative effects from that, that's not a manager who supports innovation. As a manager who supports innovation, you need to celebrate the risks, celebrate with them with the failures and the successes. And you need to be able to identify what direction you can place somebody in to make them a success. That maybe the idea didn't work there, but maybe it would work elsewhere, or maybe we just need to change that idea some. So, okay, that's what a manager's role in innovation is. Under leadership, real quick, the only thing I'm going to touch on is the difference between leaders and managers. And if you go to page 29, there's table 2.1. It talks about leadership versus management. And you'll see that the leaders are the ones who set vision, establish the mission, motivate people. They're an effective spokesperson. Often they're very charismatic. They determine strategies for the future. They help transform the organization, and they're good networkers. Managers, on the other hand, are right in the trenches. They take care of the staffing. They ensure patient-centered practices. They control resources. They supervise the service, etc. That's what managers do. And as we go through this chapter, it talks about different types of good leaders, different leadership theory, history of leadership, and some new leadership styles, including emotional intelligence, authentic, and servant leadership. I want you to read those because they're very important as healthcare changes. I have a passion for people who are servant leaders because I think they make a huge difference in healthcare. And I've only known one or two. And if you ever get to know any of them that are authentic and servant leadership, you really enjoy working for them. And the last thing I wanted to mention is ethics, ethical responsibility of a manager. Ethics is a matter of doing right or wrong. Ethics are equally important in healthcare leadership and require two areas of focus: biomedical and managerial. So if you're a manager, you need to know what the code of conduct is for your organization. Again, what's the mission, vision, values, and then usually you have a code of conduct. But you also need to know what are fair business practices, ethical business practices, and laws and regulations that guard your behavior. For instance, you don't want a conflict of interest with a supplier for your stents and you having lunch together, or persuading a physician to use that particular stent. So you need to know those laws and regulations, and we'll see some of that later in this text. And you need to promote a good ethical behavior within your department. I mentioned the code of ethics. This is a very short section on ethics in this chapter. There's many, many other things to cover, but most organizations have a code of ethics that they stand to. And in healthcare, there's a number of them that they apply to. The Hippocratic Oath, the American Marketing Association for Healthcare has one. The American College of Healthcare Executives has one for how you should conduct yourself as a healthcare executive. There's many, many of them. But as a manager, you need to know the ethics, the code of ethics for your organization, support that code, and follow the laws and regulations. Okay, I'm sorry for the long-winded lecture. I hope to cut back next week a little bit. As I mentioned, please, if you have questions, please post them in the Ask the Discussion forum. Always contact me if you have a question. Don't hesitate. I am available, like I said, most days until 10 p.m. Sometimes it's 9, just depends on the day. But I'm willing to take your texts and your phone calls. I can't wait to meet all of you in the discussion forum this week in Harmonize. And I understand it might be all new for everybody. It's new for me. So if we have some glitches, don't panic. We'll get through it. Thanks very much. I will see you in the forum this week. Bye-bye.